Hey guys, so today we're going to talk through 3 exercises. These are pretty much the main ones that I will always give to back pain patients. They're called the McGill Big 3 exercises. I've done all of McGill's courses, so big shout out to Professor Stuart McGill. He pretty much writes all the exercise programs for the Canadian military, and he is the go-to guy for all of spinal rehabilitation. So if you want to check out a bit more of his stuff, just type in Professor Stuart McGill, and there's loads of stuff on YouTube, with most of his exercises. But yeah, we're just going to go through. It's called the McGill Big 3. So there's essentially just 3 exercises that will give to really strengthen someone's core. So we'll just talk a little bit about the theory behind that. So when we're talking about someone's core, what we're talking about is all the muscles that essentially go around the spine. So we're going to work 3 sets of muscles. So your rectus abdominis at the front, the side muscles, which is the muscle that attaches from your pelvis to your lower rib cage, and then each of the vertebral levels. It's called your quadratus lumborum, or your QL. So we'll work both of the QLs, the front muscles, the rectus abdominis, and then the paraspinal muscles as well. So there's essentially 3 exercises. The first one's called the bird dog exercise, don't ask me why, or more commonly the quadruped exercise. The second one is going to be the side plank, which will work those QL muscles, and the third one's just a dead bug exercise. So with a lot of Professor Stuart McGill's work, he's kind of moving away from the sit-up, because it does tend to compress the discs in the spine quite a bit, and you sort of repetitively load those discs. So you'll notice with all of these exercises, we're not actually moving the spine at all. You're keeping your back completely neutral. So there's zero stress on the lower back. So yeah, we'll just go straight into those exercises. So I've just got to move the camera down a bit. Perfect. So the first one, it's called a bird dog. So you want to find that sort of neutral range here. Really sort of lock in the core muscles, and then we're just going to extend one leg and the opposite arm like this. And you're just going to try and keep the core nice and contracted the whole way through, trying not to rotate the pelvis. So a few kind of common mistakes with this is people will start twisting. So I use it normally as quite a good assessment tool as well, to see what's happening with someone's pelvis, whether it's twisting and rotating out of alignment. So again, we just want to sort of imagine there's like a dinner plate on your back, extend one leg and one arm this way. So there's a few sort of earlier progressions with this. So if someone's already twisting the pelvis out of alignment, we'll just extend one arm and then come back, and the opposite arm. So this is quite a good starting exercise for a lot of patients. And then once they've got that down, then they can progress to the leg extensions. And once they've got that down, move to the full leg and arm. So that's the first one. And you want to do about 2 sets of 10 on both sides of that. So the second one, we talked about this QL muscle down on the sides. So the initial starting exercise for this is you can do it with your knees bent. So you want your hips in a fairly good alignment, and you're just lifting your hips off and then come back down, lifting your hips off and come back down. So if this is really, still even doing that is really quite difficult, there's an even easier progression where you're just literally lifting your legs off just to activate that QL. But if that's being pretty easy, then do a half side plank, and if you want to do a full side plank, even better, just legs straight. Again, keep your core nice and tight before and bridging up, and you want to hold this exercise. What the common mistake is people will sort of come back down and then just let it collapse. But with this exercise, it's all about that neural connection. So you want the muscle, staying tight throughout the whole movement, even when you're finishing. So you want to bridge up, hold it tight, come back down, and still maintain that contraction throughout the whole movement. So really try and slow that down. And generally about a 30-second hold, come back down, keep it tight, do another 30-second hold, come back down. And obviously for this you need to repeat on both sides, so bridging up, hold for 30, come back down. And if that's being difficult, as we said, just a half plank. If that's being difficult, then just lifting the legs up, come back down. You do 30-second holds that way. So the final one that we'll talk about is just the dead bug. So as I said, doing loads of sit-ups, it really does compress the discs in the spine. So it's not the ideal exercise for anyone with lower back pain. So this is just a nice one that you can work your rectus abdominis without actually stressing the discs. So you're lying on your back, your knees should be at 90-degree angles, your shoulders should be down and quite relaxed in the chest, and your arms are just outstretched in front of you with your thumbs pointing towards the ceiling. So this is the start position, and already you should start feeling some activity in the rectus abdominis, which is great. And there's loads of different progressions for this, but I quite like just doing an arm overhead to start with, see how patients are feeling with this. And again, just creating that contraction through the rectus abdominis. If that's feeling okay, then do single leg extension, keeping the dead bug position. You can do a set of 10 on the opposite leg, and if that's feeling really comfortable as well, then go to a little bit more advanced, so straight arm and straight leg, opposite sides. So again, about a set of 10 on the other side, so 2 sets of 10 is normally perfect for that. And yeah, then you've pretty much worked through. If you can do that generally for any sort of physiotherapy program or rehabilitation for the spine, you want to do twice a day for 6 weeks. So that routine takes literally like 3 minutes, and it just strengthens the whole barrel, I like to call it, all the way around the spine. And once that's nice and strong, any movement that you do, you're not going to cause any sprains or strains to the joints, and you're just a lot more stable, which is what it's all about. There's only